Good afternoon, everyone. Welcome to what should be a truly uplifting hour. Thank you for joining us. I'm Debbie Gatte, Vice President of Strategy and Innovation at the Philanthropy Roundtable. For those of you who are new to us, we represent the largest network of philanthropists who support efforts to advance liberty, opportunity, and personal responsibility. As part of that effort, we are especially interested in bringing to light the work being done to strengthen our communities. We believe that strong communities are essential to a flourishing, free society, which is why we are delighted to host today's program along with the Kern National Network for Caring and Character in Medicine, which you will learn much more about shortly. Now, it turns out that medical students, in addition to studying everything about how human bodies work and how to treat them, have been quietly supporting their communities. And this has been happening not just during times of crisis, such as the pandemic. Medical students have been finding innovative ways to fill gaps in the needs of their communities where they are studying. They have been encouraged and supported in these efforts by their medical schools and by the Kern National Network for Caring and Character in Medicine. Both these groups are supported by generous funders who also share the belief that strong communities are critical. And there are many ways that philanthropy can help fill these gaps. So today, our plan is to first learn about the Kern National Network for Caring and Character in Medicine, what its mission and goals are, and why the stories we will share today are a reflection of the values that they are seeking to integrate into medical education. And after 10 minutes of discussion, we'll turn to stories from the students themselves and wait until you hear what they've been doing. We will hear from 4 groups whose efforts have solved real-world problems. And with that, let's get started. We're going to first hear from Dr. Cheryl Morana, followed by Dr. Bonnie Miller. And I'm going to quickly introduce them before turning things over to them. Dr. Cheryl Morana, I'm going to ask Cheryl to turn her camera on now, serves as Senior Vice President for Strategic Academic Partnerships and Professor of Population Health at the Medical College of Wisconsin. She is also the founding director of the Kern National Network for Caring and Character in Medicine. And following Dr. Morana, we will hear from Dr. Bonnie Miller, who is a professor of clinical surgery at Vanderbilt University School of Medicine. In 1999, she assumed the role of Associate Dean for Medical Students at Vanderbilt and moved to her current position in 2005. Now, her academic interests include the moral development of physicians and the structure and function of curriculum committees. So welcome, Dr. Morana. I'm going to turn it over to you and look forward to hearing all about the network.
Thank you for the kind introduction, Debbie. Good afternoon, everyone. I'm pleased to be with you for today's session, Inspiring Stories, Medical Students and Their Communities. Joining Dr. Miller and me are Kamara Ellefson, National Director for Partnerships for the Kern National Network, and our 4 outstanding and dedicated KNN medical students and future leaders who will be sharing their personal and learning experiences with caring, character, and human flourishing. They are Evelyn Bodenshatz from Dell Medical School, John Horn from the Medical College of Wisconsin, Ann Coogan from Vanderbilt University School of Medicine, and Helen Pham, Fiona Ng, and Anuvir Singh from the University of California, San Francisco School of Medicine. If I may have the next slide. So to begin, I would like to share a quote from Barbara Fredrickson that captures the spirit of the KNN and our time together. We firmly believe and we act on the idea that flourishing is not a solo endeavor. And I think you'll see that in the wonderful presentations from our students. Next slide, please. I thought I would take a few minutes to give you an overview of the Kern National Network. Our goal is clear: to promote human flourishing through caring and character in medicine. We have 3 major priorities: to transform medical education, to influence the healthcare ecosystem, and to engage broader society. On the left-hand side of the diagram, you see that we have innovations within our 7 schools and across with collaborations. And these areas include empowering our learners, developing faculty leaders, and transforming learning environments. And then if you look on the right-hand side, you will see that we are also committed to 4 national strategies. The first is to create partnerships across health and social ecosystems, because we recognize that we do not exist in a vacuum, that we are part of larger society. The second one is to develop future leaders, as our students here with us today. The next is to conduct and disseminate scholarship as academics. And then finally, and very important, we know that we need to affect change in systems and policy for our ideas to really take hold. And in the middle of the circle, you see the quadrants, and those are the areas that we are working to influence: other health professions education, professional organizations, policymakers and payers, public health and health systems, and then broader society. And then finally, at the bottom, you will see our 7 founding members. And with that, I'd like to turn it over to Dr. Miller, who will now talk about our integrated framework for caring, character, and human flourishing.
And thank you also for the opportunity to present this work to you this afternoon. We'd like to present our current framework, which we think of as an evolving organic entity that explains how we think human flourishing, caring, character are related. Caring, character, and human flourishing are the key constructs. On the screen, you can see the integrated framework we've developed, building on the work of scholars in the field, including Tyler Vanderweel, Marvin Berkowitz, Joan Tronto, and others. And again, to try and unify these ideas and show their relationships, how it all interconnects. Much as a tree's strong trunk and branches allow for thriving, the interconnected concepts of caring and character can be seen as the structure that supports human flourishing and advances the profession of medicine. Brief descriptions of each term give a general sense of what they encompass, and building on those fundamentals, caring, character, and flourish operate in many forms and at many levels: the individual, the organizational, the societal. They influence both our short-term day-to-day moments, as well as our long-term growth, development, and aspirations. The pursuit of human flourishing, as Cheryl said, it's not a solo endeavor, but it does work simultaneously at an individual and the collective level. And at the individual level, it is both personal and professional, and of course, those always interact. So thank you on behalf of the KNN to present this, and I look forward now to a conversation with Cheryl, moderated by Debbie.
Hi, well, thank you so much, Dr. Morana, Dr. Miller, for introducing us to this wonderful network and the concepts that you are teaching and sharing through partnerships. I do have a couple of questions for you before we go to the student stories. And one of them, it was great to see that the 7 schools that were listed at the bottom, your key medical partnerships. What we're going to see from the students are examples of those partnerships, I think, in action, right? But I would love to hear from you about those partnerships and what they look like, and maybe an example or two of how those partnerships, what are they? What are the partnerships that you're doing?
Thank you, Debbie. I think I'll start, and I'd like to highlight 3 of them. So if we think about how medical students are selected and enter into medical school, one of the partnerships we have is looking at character in the holistic admissions processes. So we're looking for different ways to assess students for medical school, such as collegiality and collaborative leadership, characteristics of character and caring, rather than simply relying on the MCATs, which is the medical admissions test, and also the GPAs. So that's one example in which our schools are working together. The next one then relates to faculty development. So if you think about how our faculty need to relate with our students and with one another, we have an initiative across the 7 schools where we're looking at how can we integrate character and caring into the faculty's view of professional development, of the curriculum that they provide. And so we have a number of efforts in that area. And then the third, and very important, is our clinical learning environment, which, as you know, occurs within the health systems. And so this brings together our schools to promote healthy learning environments such as engaging students in discussing elements of character with respect to conflict and character traits such as courage that they witness in both the learning and practice environments. So those were just 3 examples of the kinds of partnerships we have.
Oh, terrific. Wow. So from pre-admission all the way through, this is actually quite comprehensive. So I'm glad I asked that. I want to ask one more question before I know everyone's excited to hear the stories from the students. And so we want to turn to that, but I think it's important to set the context. And one of the things I heard in your introduction is that this model views the pursuit of human flourishing as being something that's both personal and professional, and that you are focused on both. And I could hear that in your answer just now, Dr. Morana, about how the partnerships work. As I mentioned in my introduction, we are interested in helping to strengthen communities. And I am interested in hearing your thoughts about why your key message for medical students is important for civil society and for making our communities stronger. How do you see that connection? And I'll throw that one to Dr. Miller.
Sure. Well, I think kind of at an almost superficial level, it would seem that if you have the collective of individuals who are flourishing, then they would contribute to flourishing, strong, thriving communities. And in return, I think it's very bidirectional. Thriving, flourishing communities contribute to thriving individuals by providing those building blocks, right, for flourishing, which include health. And we know you need healthy communities and equitably healthy communities for healthy individuals. Life satisfaction, happiness, maybe, of course, they enable you to be more giving and caring. But I think meaning and purpose is also very, very important when we think about what it takes for individuals and for communities to thrive. And that meaning and purpose is almost always, especially with our students, something much beyond themselves. And the meaning and purpose is what you give to others and what you give to your communities to help them thrive. I also think it's very important to see the entire model together and to look at those elements. If you look at character, it includes, for instance, moral, civic, intellectual, and performance virtue. And so even the idea that civic virtue and a civic orientation is built into the model. So there's lots more that I could say, but in the interest of time and getting us to those student stories, I'll hold back, and I'm happy to answer any questions like that to anybody in the future.
All right. Oh, that's excellent. I mean, clearly there is a strong connection between your model, the students, the community, and now we're going to see what that looks like all in action through these 4 stories that students have brought to us. And I'm excited to hear them. I know you're all excited to hear them too. And so I'm going to ask Kamara Ellefson to join me now, and we will move to that portion of our program. Hi, Kamara.
Hi, Debbie. Great to join you.
Great to have you here. So for a reminder for everyone, you are the National Director of Partnerships in the Kern National Network for Caring and Character in Medicine. So you are at the heart of some of these efforts and making them happen. And you're the one who helped us bring these students today to help share their stories. So we're about to show the first video. And Kamara, who and what will we be seeing?
Sure, absolutely. So the very first video that we're going to be seeing today, Debbie, comes from Anne Coogan at Vanderbilt University School of Medicine. You're going to hear stories this afternoon that have a lot to do with our current events, the COVID-19. And so, but when we start with Anne, we want to start our journey before COVID-19 reshaped so many of the structures that were familiar to us. Anne, during medical school, has really developed a passion for the concept of aging well, and that includes a quality end-of-life care. And yet, as a medical student, as a part of the care team, she observed that even residents and attendings were facing challenges, both personally and professionally, when providing palliative care. And so she took it upon herself in partnership with other students and other faculty to develop a way to have dialogue around what it means to provide compassionate care, particularly at the end of life. And what we've seen is the creation of a community and dialogue within the medical school context that as they have been able to have open and honest conversations, this has really served to impact the broader community, the patients and the families that they serve, by shaping them as professionals with skills that go well beyond technical proficiency and really demonstrate that framework of caring and character and human flourishing that's so key to the KNN. So let's hear from Anne.
It's great. What I love about these videos, just for the audience, is that they were made by the students themselves. So these are their own stories made by them, and we're happy to share them.
Hi everyone, my name is Anne Coogan and I'm a fourth year medical student at Vanderbilt. For this roundtable focused on community, I wanted to discuss a lecture series at my school called End of Life Rounds. End of Life Rounds is an initiative started by 4 students, including myself. We were motivated to start this series after, during our time on the wards and our time doing electives, we saw how straining the end-of-life care could be on both the residents and the attendings who were providing it. And on top of that, we knew it was only a matter of time before we would be in their shoes and we would be facing those same challenges. So with all of that in mind, we started to brainstorm ways that we could prepare ourselves and prepare our peers to hopefully diminish some of that stress and burden that we saw our superiors experiencing with end-of-life care. So ultimately, what we came up with was a lecture series that was designed to give students a space to talk about the challenges of providing end-of-life care, and then also providing them space to learn from palliative care and ethics experts about how to better care for this population. So where we started was we worked with the palliative care faculty at our school to identify 4 common end-of-life care issues that people struggle with, and we set out to address one topic for every lecture that we were holding. So the topics included how to approach a grieving family, how to address a patient who's hoping for a miracle, what to do when a family and a patient disagree about the end-of-life care decisions, and then finally, how to cope with caring for dying patients. So during each event, we set aside the first half for students to share their stories and talk with each other, and also to work through some discussion questions in small groups. And then for the second half of the hour, we invited a palliative care faculty member to come in and talk about a skill or a tool that they had that was related to the topic that we were discussing that day. So COVID limited our ability to hold these lectures, so we ended up actually only being able to hold the first 2. But despite that, we ultimately had 47 students attend at least one of the first 2 lectures. And to evaluate the effectiveness of these lectures, we sought feedback by surveying students after they attended. From this evaluation, we were able to show 2 pretty significant things. What we saw was that the first one was that 80% of students who attended said that their confidence increased in regards to talking about end-of-life care issues with their peers, their future patients, and their patients' loved ones. And then the second takeaway was that about 2/3 of attendees believed that the end-of-life rounds increased their ability to cope with dying patients, and then it also increased their ability to think critically about various values, perspectives, and circumstances surrounding patient death. So ultimately, we feel like these results demonstrated that end-of-life rounds effectively increase preparedness for providing end-of-life care at an individual level. And along with that, we were really encouraged that students felt like the experience made them more confident discussing end-of-life issues with their peers. Specifically with that part, we are hopeful that in increasing that confidence of talking with their peers, we'll move away from people feeling isolated and overwhelmed by providing end-of-life care and move towards creating a community that embraces open dialogue about the challenges of end-of-life care.
Wow. I mean, end of life care, this is a very serious topic, and congratulations to Anne for foreseeing how difficult this part of being in the medical profession is, and for finding a way to start thinking about it and dealing with it now. I see the connection to the framework that you were sharing earlier. All right, so we all have to deal with end of care at one point or another if we haven't already. All right, Kamar, that was very powerful. Who's next?
So next we are going to transition to Evelyn. Evelyn is at Dell Medical School. And, Debbie, as you mentioned, Anne and her fellow colleagues really figured out that moving from isolation to community when things get difficult is what we all need to really flourish. But when the pandemic first started, many of our medical students found themselves unable to do what they came to school to do. They were not able to continue in their clinical rotations, and they found themselves more disconnected than they'd ever been before from their communities and for places of service. And so in response to that, our next student discovered a community contribution that she could make, which not only helped her to flourish and strengthen her community, but enabled her to build some skills in clinical proficiency and leadership and learn a lot about public health that she may never have otherwise had the opportunity to experience. And she realized that even when, as a medical student, you're not delivering direct medical care, you can deliver something that might even be more important. So let's hear from Evelyn.
Amazing.
When the pandemic started in March 2020, there was an abrupt transition for me as I went from working 10 to 12 hours a day in the hospital to suddenly having days on end of free time and nowhere to spend it. I was on my pediatrics core rotation when all students on clinical duties were pulled immediately following the first case of COVID-19 in Austin. A week went by before we were told that we would not be returning to clinical duties until June at the earliest. Instead, we were to finish our didactic sessions for this rotation and take the exam at the end of the period as planned. Then, we were to start our dedicated study period for our first board exam. At first grateful for the extra time to study, the chance to catch up on television shows and friendships I had neglected for the better part of 8 months, I quickly found myself isolated, lonely, and, frankly, bored. I was at the stage in my medical career where I was beginning to think about what my residency application would look like and how to study for my board exams. Even though I had spent the last 8 months spending time with and taking care of patients, just a few weeks of being removed from this environment and forced to concern myself with studying and resume building had me oblivious to the real and eventual impact I would have on my community as a physician. A few weeks into the pandemic, the opportunity came up to volunteer with a local food bank and a colleague's produce delivery service to help pack and deliver groceries for the more vulnerable population in Austin. Desperate to get out of the house and feel productive, I quickly jumped on this opportunity. For the first few days, I primarily loaded bags of groceries into my car and drove around Austin to drop them off. We were doing contactless delivery, so I only ever saw my recipients from a distance as I waved at them to ensure the groceries were delivered safely. Even with this simple task and minimal contact, I was able to explore parts of Austin that I had never been to before, even as an Austin native, and feel like I was doing something good. After all, I was literally putting food on these families' tables. While it wasn't directly related to medicine or patient care, I valued the community exposure I received in this role and the chance to see the kinds of conditions my patients lived in and what their lives were like outside of the clinic or hospital. I quickly transitioned to a leadership role as the operation was scaled up and the deliveries started being done by our local bus drivers. The number of deliveries we were expected to make grew, and thus did the number of volunteers the operation needed to corral. Because of my early experience with the process, the leaders recruited me as a volunteer shift leader so that they were able to focus on managing the entire thing. What this meant for me was assigning roles to pack groceries, move groceries to be loaded onto the buses, and supply delivery drivers with the appropriate routes and load their buses with the appropriate groceries. Most days, we had 10 to 15 volunteers with a dozen bus drivers and upwards of 150 deliveries to make. This position was a more challenging and yet more rewarding role for me. While still with my boots on the ground, lugging groceries outside to be loaded on the buses and packing grocery bags meticulously, I was also tasked with counting, coordinating, and even strategizing how to move all these heavy grocery bags more efficiently. When challenges arose, people came to me to sort them out. When volunteers were uncertain of their roles or drivers' itineraries were incorrect, they came to me to sort this out. This was a type of leadership role that my first 2 years of medical school, as a learner and low on the responsibility chain, had not prepared me for. And yet, I thrived. Every day I worked, the volunteers showed up, and the groceries were delivered. It was a team effort, of course, and the operation would have continued without me. But I felt in those days as though I was contributing something valuable to these community members. It was obvious in the looks I got from them early on, distance and across the street as they carried their groceries inside, and from the letters and emails we received from clients later on. Even though I wasn't delivering medical care, I was helping deliver something that was even more important to these families: food. When I eventually had to give the position up to start my dedicated study period for my first medical school board exam, I allowed this experience to fuel me. While the pandemic had pulled me away from clinical duties and I felt as though I was getting further and further away from fulfilling my original goal for medical school of serving others, this experience regrounded me. While I know I will make a difference when providing medical care to many patients as a physician in the future, I will always be grateful for the reminder that I can also make a difference now.
Well, Kamara, I mean, talk about not only meeting a need in the community, but supplementing her education and her experience. As you said, skills development. There were problems she needed to solve in executing this concept that put her so much further ahead of the classroom. And yeah, that's a tremendous story. Now, Austin has had a very tough week.
Yes, we are
have been
thinking of
following.
everyone there.
Yeah, and so this project is actually turning out to be much more important now than I'm sure she expected, but tremendous work. Can't wait to hear the next one. So what are we going to hear about next?
All right, let's keep going. So Debbie, as Evelyn pointed out, COVID-19 has been a powerful reminder about the ability to come together to make an immediate difference. And at the Medical College of Wisconsin, students found that they were able to make an immediate difference in the early days of the pandemic by assembling and distributing face masks to help reduce the spread of COVID-19 throughout communities within the Metro Milwaukee area. And this was no small effort. Wait until you hear what this grew into. The initiative continued to grow and expand to ultimately provide millions of masks to people in the community. This project made a notable impact through both a public and private partnership, showing what's possible when medicine and industry and the community come together. So John, a fourth-year medical student at the Medical College of Wisconsin, is going to tell us his story, Mask Up Milwaukee, and how it benefited the greater Milwaukee area.
Hi, my name is John Horn, and I am presenting Mask Up Milwaukee, the Medical College of Wisconsin's collaborative response to the COVID-19 pandemic in Greater Milwaukee. I did this project with Michelle Horn, Mac Jablonski, Dr. Zeno Franco, Dr. Adina Kallett, and Dr. Chris Davis. As we are all aware, an outbreak of a novel strain of coronavirus was declared a pandemic and a national emergency in March of 2020. The virus is transmitted from person to person through respiratory droplet exposure. Infected individuals are able to spread the virus even when asymptomatic. Already, there was a shortage of personal protective equipment for healthcare workers. After a CDC recommendation for the general population to wear face masks in public to help prevent the spread of COVID-19, the current supply was not going to be sufficient. Rebel Converting, a medical supply producer of hospital disinfectant wipes, donated the raw materials to make 1 million face masks. Early volunteer mask assembly and mask distribution efforts were facilitated through the collaboration of the trauma surgeon, Dr. Chris Davis, a small group of students from Medical College of Wisconsin, and faculty and staff from the Kern Institute. Mask Up Milwaukee was a local crisis intervention initiative really made possible through the partnership of Rebel Converting, local nonprofits, and MCW. In the early months of COVID-19, the project utilized a grassroots public health approach with what resources and manpower could be found. A three-pronged approach included mobilizing volunteers to assemble masks, disseminating public health messaging through multiple media outlets, and prioritizing the distribution of masks to underserved and high-risk populations. Here we have a few pictures from our volunteers. On the left, we have shipments of assembly kits that were received from Rebel Converting. Volunteers would take and assemble these kits and return them to Kern Institute. From there, these masks would be distributed to community partners to further distribute these masks within their community. On April 3rd, mass production began. In 1 week, volunteers constructed and delivered 33,800 masks to community health centers and vulnerable populations. The early success prompted Rebel Converting to increase their donation to 3.5 million masks in conjunction with private-public partnerships, including the Milwaukee Bucks and United Way. By the end of the first month, over 600,000 masks were distributed. In the following month, that number increased to 2.1 million masks sent to more than 500 social services agencies in Southeast Wisconsin. Currently, the project has delivered 3.2 million masks and counting. In conclusion, Mask Up Milwaukee was a grassroots public health initiative that leveraged strategic partnerships, community engagement, social messaging, and volunteer efforts to provide masks to the Milwaukee community. This project demonstrates the influence that a surgeon can have as a leader outside of the operating room. Furthermore, this provided unique first-hand opportunities for medical students to influence their community swiftly and methodically in the face of a crisis. This experience highlights the importance of educating future healthcare professionals on the basic principles of public health, community engagement, and advocacy, which is currently lacking in their curriculum. In terms of future directions for this project, we are preparing manuscripts for publication that further detail MCW and Mask Up Milwaukee's response to the COVID-19 pandemic. Additionally, this project has highlighted the importance of developing an educational curriculum for medical students to prepare them to respond to similar public health challenges they may face in the future. We want to take this time to acknowledge Dr. Chris Davis, Dr. Adina Callett, Dr. Zeno Franco, Dr. Cassie Ferguson, and Ms. Joan Wise, as well as the Mask Up Coalition. Thank you for your attention, and I'm happy to take any questions.
And I love the swiftly and methodically aspect of this, which is so important when you're actually in the chaos of a medical practice, right? To actually be able to hold that demeanor. So, wow, that's very, very impressive. I want to encourage people to ask questions in the Q&A box. We have 3 of the students are actually here with us live, and they're waiting off the virtual stage to answer your questions about their projects, about any of the work that they're doing in the community. And we also, of course, have the people from the Kern Network here too to answer your questions. So please put them in the Q&A and we will get to those soon. But before we do, we will have one more story to share. And I'm curious, we've got 3 students involved in this one. Kamara, I'm going to turn this one over to you.
This is much like the amazing partnership and collaboration that we saw in John's story about Mask Up Milwaukee. Our next group of students, they were a collaboration among themselves, and they also partnered with community-based organizations and community members across the globe in order to overcome a particular challenge that they saw posed by the pandemic. As medical students, they were very aware of medical misinformation that was circulating on social media and chat type platforms and often got questions from friends and family looking for reliable information, right? You're in medicine, tell us what we should really know. But what they found was that in many cases, good, solid science-based information was only available in very limited languages. Recognizing the importance of culturally relevant care, they worked to create a website and an app to reach communities without access to medical information in their native language. And so I'm very excited to introduce Helen and Fiona and Anuvir from UCSF, University of California, San Francisco School of Medicine, to have them tell you about how this initiative developed and the contribution that the students made.
Excellent. Great. Let's go.
Hello. Thank you for giving us the opportunity to share our work with you all today. We are the three of the medical student co-creators of the COVID-19 Fact Check website. We will start with a brief introduction of ourselves. My name is Fiona Ng, and I'm a fourth-year medical student at UCSF. I'm also an MPH candidate at the UC Berkeley School of Public Health. I'm a part of the UCSF Prime US program focused on serving urban underserved communities. I'm interested in pursuing internal medicine and serving patients impacted by language barriers and immigrant communities in the urban setting.
Hi, my name is Anuvir Singh. I'm a fourth-year medical student at UCSF School of Medicine. I'm currently on a gap year pursuing an MPH at UC Berkeley. Similar to Fiona, I'm also part of the Prime Urban Underserved program at UCSF. I hope to become a social emergency medicine physician, and I intend to practice in California Central Valley with an interest in immigrant and agricultural communities.
My name is Helen Pham, and I'm a fourth-year medical student who'll be graduating this year and going into internal medicine. My goal is to become a primary care physician for patients in our community. Anu, Fiona, and I created COVID-19factcheck.com, which is a multilingual website that is currently available in 13 different languages. We cover common myths as well as provide helpful tips about COVID-19.
So, what motivated us to create this website in the first place? At the beginning of the pandemic, we noticed that a lot of misinformation was circulating through social media, such as Facebook, and our family members and friends would come up to us and ask, "Oh, I just saw this information about COVID-19. Is this true or is this false?" In times of uncertainty, it is very easy for misinformation to propagate. However, misinformation can cause fear and may even be potentially harmful. While official COVID-19 information is publicly available, these resources are often difficult to access, or that they're difficult to understand, or they are only available in a selected few languages. Therefore, with the help of our web designer, Sean Park, our goal was to provide reliable and easily digestible information related to COVID-19 in multiple different languages.
Next, we're going to discuss about what makes us unique. So our goal for this project was to create a user-friendly website that is easily accessible through multiple electronic devices, including laptops and cell phones. Through our website, we were able to reach communities that traditionally have had limited or no access to health information in their native languages from national and or local sources. Some of the languages that we targeted include the Pacific Islander languages such as Tongan and Bislama. We collaborated with a large team of interprofessionals, and the content was adapted from credible sources such as peer-reviewed scientific articles, the CDC, and WHO website, among other sources.
We want to recognize the effort of our entire team. We first started off with UCSF medical students, but we soon expanded to health and pre-health students across the world with the help of the nonprofit organization, the Asia Foundation. And of course, our website would not exist without the work of our web designer, Sean Park, and our artists to help create our infographics. We also collaborated with our non-English speaking family members to help ensure that our information was culturally relevant, as well as making sure that the language was easy to understand. Additionally, we had practicing physicians review our final content.
Thanks to the hard work of our large multidisciplinary and multilingual team, we were then ready to share our website with the communities. With the support from the UCSF Community Engagement Center and numerous UCSF faculties and staff, we were able to reach communities through a multi-pronged approach. First, we reached out to community-based organizations, also known as CBOs, who often have the trust of their communities, as well as the knowledge about the communities that they serve. These organizations included the Jakarta Movement, NICOS in San Francisco, UCSF Latinx Center of Excellence, as well as other CBOs with long-established working relationship with UCSF. Secondly, we wanted to reach the larger general public. We worked with media and news outlets to do so. Some of these local news outlets included Chron 4 and SF Chronicle. We also had the opportunity to actually work with ethnic media outlets, and these included the Chinese radio, Singtao, as well as KTSF, in which a lot of the promotion and interview were done in Chinese. And lastly, we used social media. Given that the misinformation was spreading through social media and chat apps, we wanted to counter that with facts instead. And our web designer created easy-to-share functions on the website itself so that viewers can easily share our website with those that they are chatting with through WhatsApp, Kakao, Twitter, Facebook, and WeChat. Lastly, thanks to all of our classmates and team members for sharing this website with their circles and connection.
And finally, next steps for our project. We're currently in a phase of creating content on COVID-19 vaccine myths and plan to update our website once this content is finalized. Also, we're always looking forward to collaborating with folks who may want to partner with us and help us reach a wider audience by creating content in languages that are not currently available on our website. I think that's it for today. Thank you so much, and I'm here to answer any of your questions or concerns if you have any at this time. Thank you.
Amazing.
Yeah, completely amazing. So, yeah, I see how this is. We started with the description of the framework and the values that you're looking to impart. And now we've seen it in action, and there are some clear takeaways from these students. But let's get the students up here so that we can ask them some questions. So Anuvir and John and Evelyn, hi. It's great to see all of you. Thank you for taking some time out of your busy schedules to be here. I'm going to ask you to turn your mics on so that we can have a conversation with you. Great. Okay. So, wow, congratulations to each of you for the work that you did with the teams that you were working with to solve some real world problems. And I am curious about a few things. So I know medical school is very demanding, right? It is a demanding program. My brother went to medical school. I watched it. It's an incredible amount of work. So how do you balance the work that you want to do with your communities with all the other demands on your time? And I'm asking because the personal human flourishing part of this is a big part of what the Kern Network is encouraging, right? So talk to me about the personal flourishing side and what you're learning now about balancing multiple demands on your time. And why don't I start with Evelyn, just because you're in the middle of my screen.
Hey, thanks for having me. That's a good question. I think one of the really big things for me is going to a medical school that really enjoys and really motivates us to do this kind of work. And so our schedule actually allows us a lot of the time to be able to engage in this type of work. So we do have a lot of constraints during some of our time, but we actually have our third year of medical school reserved for a research project or a master's degree. And so we have a lot more free time during that year to engage in the community and engage in other projects that we're interested in. So they're very good about making sure that we have things outside of medicine that we want to, that if we want to explore, we can explore them and gain skills in other areas as well. And it's kind of built in our curriculum. So I think that has been really beneficial for me. I think another thing to say is just that for me, I find giving back to the community and doing things like I mentioned in my video as very re-energizing. So it's kind of like something I need to do in order to kind of have the energy to get up and go do the studying and the taking the exams and things like that. So personally, I try to make sure I include that in my work because it is the most one of the most re-energizing things that I do. And it kind of gives me back the energy to be able to go forward with all the other things in medical school that are maybe not as enjoyable or re-energizing as, working.
Fuel. It's fuel for you. Yeah. Awesome. And you here, what about you?
Very similar to Evelyn. I think the work that we did was very energizing. So often in medical school, we forget our purpose. Like you have to remind yourself why you're in the medical system in first place. Oftentimes we're so busy with tasks, meeting deadlines that we forget why we're doing medicine, like in a broader scale of things. So this pandemic not only just highlighted that for us, but also reminded us of our overall purpose in medicine. And I think for me, providing compassionate care and services to those that traditionally have not had access to those services. So we kind of like for our project, we targeted languages that are not, that don't have access to credible sources from CDC or WHO. So we targeted those languages and try to provide information and provided valuable content for those communities, including my family. I speak Punjabi and I have found no credible sources on COVID-19 prevention in my language. So it was humbling experience for me to serve my community and with the medical lens, I guess. And like Dr. King has said, the time is always right to do what is right. So we thought the pandemic was the perfect time to do this project. And it was 3 of us that we collaborated. It was going to be a small scale project, but we ended up partnering with students all over the country. And we also had medical students from abroad. We had a medical student from New Zealand that worked with us on our project. So it was nice. It was a nice community gathering, I would say. And yeah, it just like reminded us of our purpose in medicine and why we're doing this work.
No, that makes so much sense. And a quick PS, I just loved the idea that you went to your families for help with the language part of that. This is that's great. I'm sure they were happy to help.
Definitely. We just wanted to make sure that the content that we were writing was not medical, like jargon heavy, and that they could understand and that they had some cultural relevance to it. So even though we did translate from these like credible sources and peer-reviewed journals, we made sure that people were able to understand in their languages and that it had some cultural context to it.
Yeah, it makes sense. John, first, how are you in Austin? Gotta ask, how's it going?
I'm actually in Milwaukee.
But, oh, good. Actually, yeah. For once, it's good you're in Milwaukee. But tell me about how you balance that, demands of your program with the work that you did, and what did you learn about that for your own flourishing in the future?
Yeah, no, I think the word flourishing is very fitting. I think that during the first years of medical, especially, there's a lot of studying, but I think it is important, like both of the other speakers has shared today, to really remind yourself of the reason that a lot of us go into medicine, to be able to connect with individuals and communities. And our mass project really allowed us to do that. And just being able to interact with people in the community who, may not know that much about the virus at the time, who needed the equipment to provide them with something tangible that they could use to protect themselves and their families was truly a privilege. And I think that really inspired all of us who were involved with the project to participate in this type of work in the future.
Very, very good. And you know what? I was just reminded that I have mixed up my medical schools, and Evelyn is the one who's in Austin. So Evelyn, how are you doing in Austin?
I'm doing okay now. My power was out for about 50 hours, I think, maybe a little bit more, but luckily I was able to go to a place that had power and water, and I'm back home now. Snow's melting. This is like the first time we've had snow of this caliber, and it's been freezing for the whole week, and so we just kind of couldn't handle it. So, but we're kind of on the upswing, I think.
Good. Well, I'm glad you're out of the worst. So I want to pick up on something that you mentioned in your video and get everyone to comment on this. So you shared that there were some skills that you were put in a position of having to develop that are going to serve you well in the future as you move into the professional part of your life. Tell us about how did you learn those skills? Was it just really by doing?
Honestly, yes. I asked a lot of questions to people around me, and other than that, I learned on the fly. I think it's important to work with people who are forgiving and who also want to help. And so that was really nice that, we had a bunch of people that we were working with that were, they were there to volunteer. So it's not like they were there to make my life hard. They were trying to help. And so it was really nice working with all those people. And I kind of, had to make them give me grace, and they did. But other than that, I kind of learned on the fly. And I think it's hard because in medical school, especially in clinical rotations, which is where I was prior to the pandemic, you're kind of like following people around and like just doing what you're told kind of experience. And so it kind of was a flipped switch for me to be like, kind of like, this is my responsibility. Something is my responsibility. And if I don't do this thing, then it won't happen. And I think that was kind of where I was like, okay, now I need to like actually think about this and strategize and like make decisions, which is, I think, different than my experience had been in medical school. So.
Oh, okay. Thank you. That's, yeah, I'm so glad that you had people around you to support that process for you. And I think that's going to serve you so well going forward in the future that you learn that. Yuvir, I am guessing, based on the story that you told, that collaboration and how to do that well was a skill that you had ample opportunity to practice in your project. But what are some of the other skills that you learned that, from a leadership perspective or a management perspective, that you think you'll be able to apply later?
Yeah, definitely. Collaboration was huge. Collaborating with community organizations, putting communities at the forefront was something that I realized how important it was to disseminate information to communities that have generally not had access to those information, because those organizations had already established trust with these communities. So it was important for us to reach out to community organizations to disseminate our work. I mean, we could have posted on social media and whatnot, but we're already teaching like my audience, which is already, most of them are well educated. So we wanted to create content for communities, not just like for medical students, but for our families or for folks who have traditionally had no access to information. So we try to create platforms where they could share information in multiple different platforms via WhatsApp or Facebook or Instagram, and the links were readily available for them to share, like on our website. So collaborating with communities, like you mentioned, was the forefront of her project. And secondly, working with multiple medical students and organizing was a team effort. I wanted to credit my other co-creators who are not able to be here today, Helen and Fiona. We all reached out to our circles and try to like get as many people involved as possible. And also want to give a shout out to a few physicians who helped us vet our project content to see that what we were writing, even though we were using credible sources, but we also wanted an expert eye and to see that the content was actually valid from an expert point of view before we published it. So wanted to give a huge shout out to physicians at UCSF, and one of her friends, classmates whose parents are physicians in Korea. They helped read the content and provide us feedback on it. So it was a huge collaborative effort, a lot of leadership skills that we gained throughout this process, and how to work with people from different backgrounds, literally, and different communities, and how to organize with different time zones was challenging too. So all in all, like it was a great community effort and I wanted to give everyone in our team credit for that. It wouldn't have been possible without all of them.
Took a community to help the community, basically.
Definitely. Yes, yeah, for sure. Bottom line.
John, what about you? What skills did you pick up as a result of managing this project? I mean, there's some big numbers involved in your story. So what did you learn that's going to serve you well in the future?
Yeah, I think something that one of my mentors had mentioned early in our process was that if you want to make the impact, you're going to have to, in short, make moves. You have to be able to make a decision and then adapt as needed. And I think that's really helpful because, this was obviously an unprecedented situation, and, we can scour the literature for prior disaster management techniques, but at the end of the day, you have to make your best bet, identifying the communities that you thought would benefit the most. And we made some adaptations at the end, ultimately forming these private-public partnerships with the Milwaukee Bucks United Way to really scale our production. But if we never took those steps initially, we wouldn't have been able to have the impact that we had on the community.
Wow. Step by step to get there. Yeah, that is definitely a good lesson to take away. So we have time for one last question. And I think this is a great question. I'm really eager to hear the answers. And Evelyn, I'm going to start with you. What type of responses and reactions have you received from the recipients of your great work? So the people who have benefited, what kind of reactions did you get?
So I didn't get to see a lot of the comments from ours, but I remember one instance where I was doing the delivery and a woman who has an immunocompromised state, so she couldn't leave her house. And so we were delivering the groceries and she had taped on her door a letter about how like we were saving her life and we were like her heroes and like how grateful she was. So that kind of will always stick with me. But we did get a lot of responses to the bus drivers. Like they would email in to Cap Metro, which is the Austin Transit, and they would be like, oh, these bus drivers were so nice. They dropped off these groceries for us, like saved us a trip to the grocery store. Like now we don't have to worry about getting sick. So just kind of responses like that. I think everybody is always just super grateful and just really happy to have friendly faces that are here to support them. So I think generally that's kind of the response that we got.
Not surprising, Evelyn, as you said in your video, food can be more important than healthcare sometimes. So yeah, well done. Anuvir, how about you? What reactions have you gotten from the people who have benefited?
Yeah, the response has been very positive, and we're humbled by all the support that we received from all our community members. I can share some of the examples that I have personally, like my friends have texted me or reached out to me saying how the content that we created has helped their grandparents or their parents understand the content better, that it was really hard for them to, speak to their parents about the content in that language. And they just said that, this is a credible source. You should, read this. And then they had a discussion after that, and they were able to better understand the content and COVID general specific guidelines in general. And so, yeah, the support has been really humbling, and we've had a great positive response. I don't know how people have viewed this outside because they haven't really reached out to us, but from my family and friend circle and their parents who don't speak English, they have read our content and they have really supported it.
Oh, that's wonderful, because when you produce content, you want to know that someone's making use of it. So I am so glad that you got that feedback. And John, what about you? What have you heard from people who have benefited and the recipients?
Yeah, so I can share from both sides. So we had some volunteers who were helping assemble masks. And I think for them, during this time, they were just very grateful for an opportunity to contribute to the fight against COVID-19 and in assembling the masks. So that was really awesome to hear, and it kept us motivated. Additionally, when we were delivering them to the grocery union and helping protect those who were essential workers, I think they were very grateful for any resources that we could provide to help keep them and their families safe during this time. And like as I mentioned multiple times today, I just think the gratitude that we receive, it really inspires us to keep going.
Wonderful. No, it's wonderful. And it was a real problem. All of you are solving real world problems and making your community strong. It's really clear you're making your community stronger. So I want to thank you. We're actually out of time. So I want to thank the three of you, not only for the work that you're doing, but the leadership, and for coming to share your stories today and helping us understand what it is that you are all doing very quietly in the background here. Congratulations to all of you. Keep it up, and can't wait to hear what you do in the future. I want to thank the people from the Kern Network, especially Dr. Morana, Dr. Miller, and Kamara Ellison for being here today and sharing so much wonderful information about their partnerships and the work that you're doing. And to everyone watching, thank you for being here, and stay tuned. The roundtable is going to continue to share stories like this. There are lots of things that philanthropy can do to help support strong communities, and we want to help tell those stories. So thanks for joining us today. Take care, everyone.